My name is Marchese Chisholm, and I have been a registered nurse for 29 years at Cook County Hospital. I am the descendant of freedom fighters who worked with Stokely Carmichael in Mississippi. I am a recent graduate of the National Nurses United Medicare For All Leadership School. It is an honor for me to speak to you all today at the Chicago March for Medicare For All. My great-grandmother, Bertie Kegler, marched with Dr. Martin Luther King Jr. and Congressman John Lewis in the historic march from Selma, Alabama to Montgomery, Alabama. 10 months later, despite receiving death threats, she traveled with 4 activists, which included a 27-year-old Jewish college student, to Jackson, Mississippi. There, she testified at Senator Robert Kennedy's hearing on poverty and voter suppression. On their way back home, the Klan ran her car off the roads. My great-grandmother and a 78-year-old black teacher were decapitated. I was 5 years old when that happened. When the pallbearers rolled her casket out the church, I touched it with my little hands, and I promised her I would not cry and I would not give up. They killed the dreamer, but they didn't kill the dream, because the dream lives in me, and the dream lives in you. My great-grandmother felt compelled to fight for voting rights. Now it is 55 years later, and I feel compelled to fight for Medicare For All. Findings of a study conducted by Sinai Urban Health Initiative in 2009 revealed the following. Black Chicagoans were 8% more likely to die from heart disease than whites. Black women were 3 times more likely to have no prenatal care. Congressman John Lewis said, if you see something that is not right, not fair, and not just, you have a moral obligation to do something about it. Never, ever be afraid to make some noise. Never be afraid to get in some good trouble. As a registered nurse, I am aware that our current healthcare system fails our patients and reinforces racism, xenophobia, and classism. During the COVID-19 pandemic, patients came to the emergency room in severe distress because they were uninsured. Before COVID-19 hit, even with the passage of the 2010 Affordable Care Act, 29 million Americans were uninsured, and a minimum of 44 million were underinsured. We're up against a profit-driven healthcare system that always wants to spend as little money as possible, even when it puts nurses and patients at risk. This is not right. This is not fair and this is not just. I would like to close with a quote from Rosa Parks, the mother of the civil rights movement. People always say, I didn't give up my seat because I was tired, but that isn't true. I was not tired physically. The only tired I was tired of giving in. When Nancy Pelosi, the majority leader of the House, refused to force the vote on Medicare for All, don't give in. When Chuck Schumer, the majority leader of the Senate, refuses to force the vote for Medicare for All, don't give in. When President Joe Biden and Vice President Kamala Harris refuse to fight for Medicare for All, don't give in. Keep on marching, keep on fighting, keep on pushing until Medicare for All is won and healthcare justice rolls down like a mighty river.